Hello, this is Dr. Stanley Lang. Welcome to this broadcast, which is on the subject of high cholesterol and the related questions of how do you lower your cholesterol without using a statin drug? And another related question is, do you need to lower your cholesterol if it's elevated? And finally, well, not finally, but the last thing that I'm going to talk about on this broadcast is what does it mean to be high as far as cholesterol is concerned? What's the definition of that? So the reason that I'm focusing on this today is because of a patient encounter. This is a woman who has had very elevated cholesterol by medical standards for many years. And she had a lot of fear about having a stroke and having a heart attack because of her high cholesterol. And for several years, we tried some nutritional supplement strategies to try to lower the cholesterol because she really didn't want to be on a statin drug. During this time, she really didn't alter her lifestyle very much, but she was eager to try things that might lower the cholesterol. And because she was worried about it being a problem with these risks. And we did some tests that looked like there might be more inflammation than usual in her body. So she had some reason to be concerned. But she didn't really want to be on a statin. Then as time went by, she started to become increasingly worried and decided to try the statin drug. So for probably about 3 years, she was on a statin. And then as she started to accumulate some of the side effects of statins, and as she started to read more about the downside metabolically of statin therapy, she decided she didn't want to be on the statin drug anymore. And predictably, her cholesterol levels went up quite a bit more again. And so that's led to several discussions that we've had about how dangerous is the cholesterol, what does it mean? And so I've had several frank discussions with her about how medicine approaches high cholesterol, why it approaches it that way, and how alternative practitioners often have a completely different view. So basically, as you must know if you're watching this video, the average medical doctor considers cholesterol to be enemy number one in the fight against heart disease, vascular disease of all types. And so their main goal is to get the cholesterol down. Now, the reason for that main goal is that they only have one tool in the toolbox, and that is to lower the cholesterol with statin drugs, because nothing else really works. There are a couple of other medicines that have been used, but they've never shown to have any significant benefit in terms of death reduction. So if it doesn't help reduce death rates, what does it do? What's the good in lowering your cholesterol, which is sort of cause those drugs to kind of drift off into insignificance, but sometimes they kind of drift back in as the pendulum swings back and forth. But with statins, there is at least a statistically proven cardiac death rate benefit. So that's why they use that tool. Now, there's a saying that goes something like this: if the only tool in your toolbox is a hammer, then the rest of the world looks like a nail. And so you go around looking for nails to pound. And the only tool in the doctor's toolbox right now to lower cholesterol is the statin drug, which does dramatically lower cholesterol. Now, there's a new drug called Repatha, which works by a completely different mechanism, but it's very, very expensive, more than $8,000 a year. I'm not going to get into why Repatha is not something I'd recommend for you, but just to say, now we've got another tool in the toolbox, and you can be sure that they are going to figure out ways to promote this tool. But back to the whole cholesterol question: why is cholesterol implicated in heart disease? And if it is, how can we lower it without using statins? Well, the reason that it's implicated in heart disease is because it is part of the plaque that builds up when the plaque that starts to narrow the artery with the gunk that's plugging the artery. That's called plaque. And cholesterol is a big part of that. But the problem is that the cholesterol isn't the thing that's damaging the artery. The reason the cholesterol is showing up at that plaque is because there's already been some damage to the artery. So some people have likened, and I like this analogy, blaming cholesterol for the plaque is like blaming the fireman who shows up to put out the fire. So cholesterol is showing up to try to fix the damage to the artery that has been sustained from a variety of reasons, but usually by lifestyle reasons because of the junk that we've been eating that damages the arteries. So when you have this junk floating around, it causes inflammation of the arteries, but it also causes inflammation of the cholesterol. And so inflamed cholesterol is dangerous to your body. Uninflamed cholesterol is not. It slides right by the artery. Unless the artery is damaged, it slides right by the artery, just like an egg on a Teflon pan slides right out of the pan if you're not careful. But when cholesterol is damaged by the inflammation produced by our diet and other chemicals that we ingest, then it becomes sticky. And so it's like Velcro to Velcro when you've got sticky cholesterol trying to fix an artery that's been irritated by inflammation, and that's how the plaque starts to form. So that's why doctors think it's a big deal, and so they try to lower the cholesterol. The thing is, when you look at statistics on statin therapy, there's a website that I encourage you to go to if you're interested in this, which is Number Needed to Treat, or NNT, and just Google that or whatever search engine you prefer to use, and see what the statistics are on using statins in people who don't have heart disease. And you're going to be shocked to find out that the benefit is so minuscule that these doctors who have done very careful statistical analysis show no benefit worth enough to offset the risk of the statin drug. Now, if you look at the statistics in people who have active heart disease, they do show a very modest reduction in heart attacks that cause death with people that use statins. So there is at least a reason that makes sense to use a statin in people who have documented heart disease. However, what happens in most cases is that patients are given the impression that if they don't take this statin, they're going to die. When if you actually look at the statistics, the probability of the statin helping is not very high at all. You can go to the website yourself and look it up if you're curious. And the statistic changes based on new data, but in general, about 56 people need to take a statin for 5 years to prevent one fatal heart attack if you have heart disease. Now, if you don't have heart disease, it doesn't prevent any fatal heart attacks. So when my patients look at those statistics, which I think is part of informed consent, they almost all decide they don't want to take the statin. That is not worth it for the downside, which is considerable, including muscle pain and including risk for diabetes, very substantial. There's a lot of other things I won't get into. I'm not going to get into the biochemistry of why statins are hard on the cells. So what do we do if we don't want to use a statin drug? But we know that cholesterol can be damaging to the body if it's inflamed. Well, there are two things that are very simple that I talked to this patient about today, because in spite of having tried natural things before that didn't work very well, she hadn't tried the most basic thing, which is a radical lifestyle change, which includes eating very low glycemic and having exercise that is called high intensity interval training. And I encourage both of these strategies, which will naturally lower cholesterol, but more importantly, dramatically lower your risk. So it doesn't matter to me whether the cholesterol drops very much. What matters to me is whether you're modifying your risk, and by eating very low glycemic, you markedly decrease the inflammation in your body, you decrease the inflammation in your arteries, you decrease the inflammation on your cholesterol particles, and everything becomes less damaged and less sticky. And then the exercise dramatically decreases risk of heart disease. And so when you combine these strategies, whether the cholesterol drops a lot or a little, by doing these other things, this low glycemic eating and the high intensity interval training, those independently dramatically decrease cardiac risk. So sometimes the cholesterol will drop quite a bit and people will feel better about that. But if you are doing these other things, the risk from your cholesterol, if you don't have heart disease, is not that big of a deal anyway. I'm not going to go into all the details on that, just to say that the association between high cholesterol and heart disease, it's real, but the problem is they lump everybody together. All of the people who have the lousiest lifestyles in the world are lumped in with all of the people that have the best lifestyles in the world, and then they averaged it all together and they say, this is the risk. Okay, all you guys with elevated cholesterol start taking statins, without ever comparing the lifestyle strategy that I just talked to you about and comparing that to a statin drug. I would speculate with a high degree of certainty that if you compared the cardiac benefits, the outcome benefits with very low glycemic eating combined with consistent high intensity interval training, that the death rate reduction would be dramatically better with that than with any statin drug in somebody without heart disease. So the problem is the research hasn't been done, so I can't say that that's true, but they can't say it's not true either, those that promote statins. So do I ever prescribe statins? Sure. Sometimes patients have documented heart disease. There's a definite benefit potentially there, and I give them informed consent. I tell them these are the odds that taking the statin is going to protect you from a fatal heart attack. Do you want to take the drug? Some people look at that 1 out of 55 or 56 and they say, yeah, I'll take the drug. I want to do that. And others will say, no, it's not worth it to me to do that. So that's called informed consent. And so if somebody wants it, they have the indications for it, I prescribe it. But I also, at the same time, always promote these healthy lifestyle strategies because I'm sure that they're much more powerful. How am I sure? Just 40 years of observing different kind of outcomes in people has made me relatively confident that the lifestyle is much more powerful compared to statins. But I don't think you're ever going to see a study comparing them side by side. And there's a good reason for that, because the statin companies don't want to be proven that a simple lifestyle strategy is more effective than a very expensive drug. And not only that, they want to push that new Repatha and similar drugs onto everybody to further lower that evil cholesterol. So in summary, I want to say that the norms for cholesterol elevation have changed dramatically, and they're still changing, so that a few years ago, if you had a cholesterol that was as high as a so-called bad cholesterol as high as 160 LDL, that was considered okay if you didn't have any risk factors. And if it was as high as 180, the so-called bad cholesterol, that was considered okay also. And that's actually what the statistics showed. But since then, there's been a dramatic push that the LDL should be less than 100 for everybody. And some people are saying even lower than that. Not long ago, that number was it should be less than 130 in everybody. So you can tell how these dramatic shifts are happening, because when I do a laboratory test, it has the norms, and the norms that they are putting on these tests are so low that they're unachievable by most people unless they're on a really, really strange diet. So what is a normal cholesterol? Well, it's always changing. I can't tell you what it's going to be by the time you watch this video. It's probably going to be lower than it was just this year. So paying attention to norms really doesn't help you that much, because they're changing the norms all the time. They're ratcheting it down, which then increases the number of people that qualify for these drugs. Well, you also qualify for these lifestyle changes all of the time. So I encourage you to, rather than focus on the drugs, which have limited benefit, you go to the NNT site, the NNT site yourself, and see for yourself, see what you think. Those are real numbers based on real medical studies, put in real world language that people can understand. In other words, how many people have to take this drug for 5 years to get one benefit? That's what NNT means. And when people look at those numbers, as I said before, they're just shocked that it is so bad. And the drugs are made to look like if you don't take them, you're going to die for sure. So I believe firmly in informed consent. People should get the whole story so they can make a completely informed decision. They shouldn't have decisions made for them with half the information held back. So I encourage you to approach your high cholesterol issues, if you have them, with lifestyle strategies. Is the most powerful thing to do. If you decide to use medication, look at the statistics for NNT. How many people need to take that drug to get the benefit? What are the downsides before you start the drug? And either way, I wish you well. God bless. Hope this information has been helpful to you. Oh, and by the way, if you want to learn about low glycemic eating, I'm giving away a free book. You can click on the link below this video, and it will give you that information. I wish you well. God bless. Have